Hello, my name is Justin McAdoo. I'm a student in the Doctor of Nursing Practice program at Arkansas State University. This presentation focuses on a policy analysis of a substance use disorder policy for certified registered nurse anesthetists. My faculty mentor is Dr. Christie Black. Substance use disorders are the most common occupational hazard for CRNAs. An estimated 15% of practicing CRNAs will have a substance use disorder at some point during their career. Three major occupational hazards for CRNAs that impact the development of substance use disorders are drug accessibility, attitude, and occupational stress. Studies have shown that employers can avoid unnecessary and non-productive costs if evidence-based policies are in place that include offering their employees appropriate treatment and assistance with their substance use disorder. Anesthesia workplace policies and procedures are beneficial because they serve to identify the institutional goals and objectives, describe the strategy for achieving the goals, serve as a basis for future decisions and actions, control performance, and increase consistency of action. Few anesthesia groups have knowledge about the avoidable costs that an evidence-based substance use disorder policy can produce. It is vital for employers such as anesthesia groups to understand the impact that substance use disorders have on their organization and develop strategies that address the risk and costs associated with CRNAs with substance use disorders. This scholarly project seeks to answer if the substance use disorder policy for certified registered nurse anesthetists employed by lifelink anesthesia follow the current best practice guidelines. The purpose of this scholarly project is to analyze lifelink anesthesia's substance use disorder policy for CRNAs, compare it to the current best practice guidelines, and if applicable, present recommendations for policy revisions to key stakeholders. This policy analysis will seek to discover and address any evidence-based practice gaps associated with lifelink anesthesia's substance use disorder policy. The conceptual framework selected for this scholarly project is Eugene Bardak's eightfold path for policy analysis. Peacock approach was utilized to develop this scholarly project. Policy analysis was carried out. A review of the literature initiated the process by collecting all the currently available evidence-based research related to the current best practice guidelines. The current condition of lifelink anesthesia's substance use disorder policy was examined to determine its benefits and its risks. Lifelink's anesthesia substance use disorder policy for CRNAs was compared to the best practice guidelines for a substance use disorder policy in order to discover any gaps between the current substance use disorder policy and evidence-based practice. Also, lifelink anesthesia's substance use disorder policy was evaluated for any possible revisions in order to align with the current best practice guidelines. Phase 1 involved performing a SWOT analysis of lifelink anesthesia's substance use disorder policy. The data collected during Phase 1 was utilized in Phase 2, which included a gap analysis between lifelink anesthesia's substance use disorder policy and the current best practice guidelines. Recommendations for revisions were developed, including evidence-based education related to substance use disorders, prevention strategies, treatment options, and support for CRNAs and their families. Educational recommendations include adopting evidence-based strategies for promoting the healthy well-being of CRNAs, adding appropriate language outlining the general and anesthesia workplace specific risk factors, and adding a list of signs and behaviors associated with impairment and drug diversion, adding to the substance use disorder policy a list of harmful consequences of drug diversion and substance use disorders in the anesthesia workplace environment. Also included are considerations for drug diversion prevention strategies. Additional recommendations focused on specific procedures such as random drug testing, workplace reporting, interventions within the workplace environment, treatment options, and reporting to the appropriate state board, reentry plans, contracts for reentry, and promoting a healthy workplace environment. Best practice guidelines offer a blueprint for developing a structured substance use disorder policy that includes education, prevention, detection, treatment, and reentry procedures for CRNAs with substance use disorders. Effective substance use disorder policies and procedures that are clearly defined provide illicit responses to situations that place the safety of patients, colleagues, and the individual at risk, as well as the anesthesia group or healthcare facility. I hope you enjoyed my presentation. Thank you.